Welcome to Tapping Wisdom. I'm Sue Paternak, and I'm very happy to introduce Dr. Harvey Castro, who is going to speak with us about the future of artificial intelligence in healthcare to prevent and to mitigate burnout. So Dr. Castro is an innovator and serial entrepreneur in healthcare provider and supplier technology ventures with the purpose of leveraging technology to improve patient care while also returning the thriving practice of medicine back to physicians, nurses, and other healthcare providers. So Dr. Castro and I met at the UC Irvine Paul Merage School of Business Healthcare MBA conference a number of months ago. And the first thing we discovered is that we grew up a few blocks from each other in Queens, New York. Woo-hoo! And then we started talking about his presentation on the panel about the use of AI in healthcare. And we started talking about my dissertation and my study of the work of burnout. So we thought it would really be interesting for my audience to hear what you have to say, Dr. Castro, Harvey, about the use of AI in healthcare to prevent or mitigate burnout. Shameless plug on Dr. Castro's book on ChatGPT and healthcare, the new future of medicine. So, Harvey, would you kind of further introduce yourself to our audience and tell us how you came to be doing this work?
Yeah. Well, first of all, thank you so much for having me. This is a lot of fun. Honor meeting you and knowing that we're from literally the same hometown, which is New York City. Is hard to say it's a hometown, but we literally are from like the same area, zip
Within
code.
blocks, yeah.
Yeah, within blocks, which is even better, I think.
Yeah.
So, sorry. And so big picture, how did I get into this? Well, I love going into my backstory. I'm not the typical doctor in the sense big picture, I grew up with humble beginnings, and I really have always just been one of these guys that just thinks outside the box. And so big picture, just to give you a quick summary, when I was in, let's say, high school, I literally remember had a paper route for the New York Times, and I was literally just, whatever extra newspapers, I would end up going by the subway, and I was probably like 12, selling them for
And
like
I know
10
which
cents.
station that was.
Yes, exactly. And I remember so much. It was 35 cents what the paper cost for the New
Yeah.
York Times. I was selling it for a quarter because I was like, all right, I'm going to sell these quick, get an extra buck or two, and then off to school. And fast forward, I couldn't afford college. I was like, all right, I'm going to join the army. And then when I was in college, I couldn't afford books. So I thought, let me contact all the book companies and get free books and tell them I'll be an editor for their book, but I'll just do it for free. And fast forward, I was doing it in med school and then creating cliff notes for medical students and selling those. And then later in residency, I was really big on heart health. My dad had passed away from a heart attack, and I thought I need to do something. So I remember reading all this research on different vitamins and different concoctions. So then I was like, let me make up my own formula. Let me get a hold of a cardiologist and let's just start selling vitamins nationwide. And then to get to the story, finally, here I am playing with ChatGPT in November of 2022. And I thought, holy cow, this is going to change the way we do healthcare. And it reminded me of a moment that I had when the first iPhone came out. I was in the emergency room coding a patient, and I thought, man, let's start this IV drip on the patient. And I remember telling the nurse, hey, let's go. And I remember the nurse saying, okay, 1 second, got a big textbook, thumbed around, found the medicine, found the drip. And I thought, oh my gosh, this is taking so long. There's got to be a better way.
And
And I
what happened
thought,
to the patient in that time, right?
yeah,
Yeah.
when literally seconds count, a minute less could help a patient, if you could cut down a minute. And so I created the first app called IV Meds, launched it when the iPhone 1 came out. It went literally viral. So it was in the top 10 in the world. And with that, I thought, wow, okay, now I can hire a team and let's start doing more for patients and healthcare. And so fast forward, ChatGPT falls in my lap in a way. And I thought the same moment, I'm like, whoa, this is going to be big. And this is kind of funny. I remember writing the book, and during the Christmas holidays of 2022, my wife's like, what are you doing? What's this ChatGPT? What's consuming your time? And I said, oh my gosh, you don't understand. Like, this is going to be big. And I remember her telling me vividly, she's like, you know that nobody knows what you're talking about. And you know when your book comes out, no one's gonna buy it because nobody knows what you're doing. And I said, I don't care. Like, even if it's one person, it's gonna make a difference. And from 10,000 feet high, I thought, no, let me jump in there and just kind of be that advocate because it started honestly as a public service announcement.
And so with that public service message it resulted
That book.
into this book.
Yeah.
And then this book kind of went the same way as your IV meds app did. It started to really blow up on Amazon. So of the work that you did, and clearly this took a lot of research on your part, I'm really interested in seeing, there's a long list of things that ChatGPT can apply to in
Yeah.
healthcare. What would you say are the top three that have the most application to helping to address the burnout that physicians, nurses, PAs, et cetera, are all feeling with the administrative burdens, right?
Yeah.
So that's kind of on the reducing the pain side, and what are the opportunities that it's creating that are, that are making it actually interesting and fun. So if you could kind of cherry pick some top, like maybe the top
Yeah.
three
Yeah.
that
No,
come
that
to
sounds,
mind. Yeah,
yeah.
I think that would be interesting.
Well, the first one that's the most obvious that's in the news is the clinical documentation assistance. As we all know, OpenAI and Epic and Microsoft have gotten together to create this amazing platform and using AI with their current Epic. And I really think that it's going to be, from a historical point of view, just a huge point because obviously everybody out there is aware of HIPAA issues and privacy and hallucination effects. So if they can figure out how to integrate these products and help our patients and decrease the time that doctors are spending and healthcare staff in general, just in our nurses and our teams out there just spending so much time documenting, if this can make it better, then that's one way.
Yeah,
Taking,
before you
go ahead.
continue, for
Yeah.
those who are not in healthcare, can you just explain what Epic is? Microsoft's Epic?
Oh yeah. Yeah, no, that's true. Think of different brands, like we got Pepsi, we got Coke. Well, Epic is a brand that helps with the electronic medical record. And most physicians use some type of electronic medical records. This happens to be one of the largest ones out there in the hospital systems, but obviously there's other brands. And that's why I love that example, because I feel like once they have a product that's being out there and they show how they're using it, how they're working with HIPAA and how they're implementing it in the hospitals, there's a lot of questions out there. Then all of a sudden, I think someone like you and I could literally, in theory, with the help of ChatGPT's OpenAI's APIs, we can literally create products literally overnight. To take it to a,
So Craig,
go
give
ahead.
me a story. Give me an example of how that might apply.
Yeah, I like this example because that was the next level. So obviously one of the healthcare is a very intimate example because it's not like you and I are picking a stock and I'm going to put some money in it. Like if it's healthcare, there's a big trust, and
Yeah.
that trust is on you and I. But now I'm bringing a third party. I'm bringing AI, and so part of it also is going to be an adaptation to this. But let me give you a real example. One of the biggest problems is communications between a patient and a doctor. And it could be seen in several ways. One is I'm just talking to you, but then if my hands or and fingers are down, looking at my fingers to type, I'm not looking at you. And so right off the cuff, I'm missing out on so much information. So if you say are embarrassed about X and Y and don't want to tell me, but your eye twitches or something, if I can only hear your change in your response, but if I see it, I'm like, whoa, let me probe into this a little bit more. But if I'm looking away, what my point is now AI, ChatGPT can help augment that. Connect. OpenAI actually has this product called Whisper, and it could transcribe our whole conversation. And
So
so,
it's basically voice to text.
yes.
So how
And
is that better than any other voice to text
well, wait,
application?
yeah, awesome question. So when you
Yeah.
combine the two, and now you're able to put Chat GPT, the engine, the mind, in the sense that it can create summaries, it can summarize. If I'm a horrible typer, as you have autocorrect, it would be the same thing. It's prompting you, it's helping you create that note. In fact, in the EMR, you have to follow the tab, you have to follow the structure. Instead,
EMR, electronic medical record. Yeah.
Thank you.
Yeah.
And so
It's okay.
instead of me having to go from A to B to C, what if my approach is let's go C, B, D, then go to A? As a conversation, it's very awkward. If I've had doctors that they read the script and they're just going down and they sound
Yeah.
like a robot, why not have a conversation? You're more open to
Which
just
is
communicate.
exhausting for doctors too, right? They don't want to
Yes,
be
yes.
constrained that way. They want to
And
have natural conversation too.
exactly. So
Yeah.
there's all these studies that using AI and ChatGPT to help you with create the summaries, help you with the note taking, help you spend more time with you and I, just patients. Now, instead of me, some studies, and depending on the specialties, it could be 2 hours a day of extra documenting that could go away. So that's two
Oh,
hours added to
yes.
my life. And
Mhm.
so that's a huge way of using AI, specifically ChatGPT, but then the future isn't just one technology. It's going to be like we just said, the transcribing. Excuse me. The other thing will be this camera I'm using. In theory, there's algorithms out there that, believe it or not, that camera can give you my blood pressure right now. And it can
Oh,
give you
wow.
my hemoglobin A1C, which is the average sugar in your body, like all this information. And I've seen some demos where it can actually do a pretty good job of guessing your age based on just the camera. So there's all this other stuff in that technology is going to make my life as a physician better.
Yeah.
And that's one that's just common, but the other ones that I think that we don't talk about. Let me talk about another one that's a low hanging fruit. Back to communication. Doctors talk doctor words, doctor terminology, and sometimes, and I know patients say, "Oh yeah, doc, I know exactly what you said." They're not going to correct the doctor and be like, "Oh, I don't know what you just said." There's some that will, but a lot of the people out there
Yeah.
are either embarrassed or they are so worried. Because I get a lot of times like, "I just don't know what worry you, doctor. I know you got all these other patients. Let's just be quick." And I say, "Hey, did you understand?" And I can explain, and I can see in their eyes, they're like, "No, I
Yeah.
don't understand." But verbally, they're like, "Oh yeah, I got it." And so using the power of ChatGPT, I could plug in my discharge instructions and say, "Hey, help me break it down." Believe it or not, we have
Simplify it. Yeah.
simplify it. And,
Yeah.
to make it even a better example, this is my favorite example, by the way. If I saw this out of a hospital in England, the skinny is they had a 5-year-old first time asthma, and instead of giving the child these papers and say, "Here you go," they actually took the papers that they normally would have, fed it into ChatGPT and say, "Change this language and use the voice of a 5-year-old." The
Oh my
aspect, the
gosh.
examples. Let's convert all of this. But then this is the part that gets me like goosebumps. And I know that sounds odd, but I get really excited.
Yeah.
They added Dolly, which is basically a text and it makes pictures, and they made it into a coloring book and they added together. And then now they gave the child a coloring book that was a discharge summary. And I thought, oh my gosh, this is so
Wow.
smart because as
Yeah.
a new patient that has no idea about asthma, it might be exercise induced, where if they're running, they cause them asthma. They need to check their asthma levels and stuff like that. A child talk to a 5-year-old is really tough. But if you have them coloring and then you're the parent or you're the doctor, the nurse, and you're sitting with the child will take it in, like really take it in. And so I thought, man, this is a really good example how we could use AI to really communicate to not only to a person, but the other part is just this
No
experiment that
way.
I just mentioned. We talked about this. You warned me, you told me this experiment about a doctor and a patient. So now we can speak their language. And then the other part to this, I thought, well, you know what? Not every disease is the same. Why should I discharge with the same discharge instructions to everybody that comes in with diabetes? When
True.
in
Yeah.
reality, it's a different type of diabetes, or it's a different. To give you a quick example, the difference between a child that just got diagnosed with diabetes is way different of me discharging someone that's had diabetes for 20 years. There's different things that I want to
Right.
cover.
Yeah,
And so
sure.
why do I have to give them the same discharge instructions to the same? No, that makes no sense. So, but now with the power of ChatGPT, I could say, hey, this person has had diabetes for 10 years. They also have hypertension. They're due for an annual checkup in another year. We should probably add the following tests. We probably need to do X, Y, and Z. They've already had one. We need to say this was abnormal. This would be a better discharge instruction.
Yes, exactly. So you're saying these things, and then Chat GPT can capture some of the other
Yeah.
implications of that and include that as well.
Exactly. And
Yeah.
so what I don't know this for
Wow.
sure from Epic, but the fact that they have the data, they can actually help make these summaries that we're talking about,
Uh,
help create the brains behind it, saying, okay, use this feature when the doctor says this, summarize these things, where it's almost like prompts in the background that are creating all this. So then the doctor looks at it and say, oh yeah, I give it my blessing. And so it's
Right.
not actually adding work. I think it's taking away work, and it's actually helping the patient. Because one of the things I hate to say as a profession, we suck at discharge instructions. We don't do a good job, you know?
Yeah.
We need to do a really good job, because if we do a really good job,
Yeah.
then we've done a good job for their health.
Yes, and let's come back to the 5-year-old with first time asthma. Yeah, because I'm thinking, so to what extent is that coloring book that you talked about? I'm thinking of all the pediatric physicians out there who I know, is reducing that child's anxiety, which of course creates a better learning environment for them to then understand and take that in, which can then result in, better compliance with
Mhm.
those instructions and better outcomes.
Exactly.
So, that can work with a child. Something, parallel to that, of course, can happen with adults, but
Yeah.
you can also think of that as being, helpful for people who might be, developmentally disabled in some
Yeah.
way, right? So it could be put into language that's helpful for people, who are, dyslexic, learning
Yeah.
disabled, etc. So there's all kinds of implications of that.
Yeah, let's take that to the next level. With the 5-year-old that we mentioned, what if there's AI out there that can create a clone voice of a parrot or of a child? And so in theory, you could feed this into that AI, and then an audio would be coming of another child kind of going through it, where the child's hearing another child, not an adult. Because sometimes some people, again, they turn off if they hear certain things.
Yeah.
Then you and
Yeah.
I are from New York. We get that East Coast angle. There's a culture.
Yeah.
There's a lot. You and I grew up in a melting pot, so we are
Yeah.
aware of other populations. So you know what I'm saying. What if I told ChatGPT, "Hey, I have a patient here. I used to work by an airport. I have a patient here from Africa. They are this customs, blah blah blah. I don't have to list the customs, but I want to speak to them as best in their language. So it's not in English. And I want to talk to them using examples of their culture or of that region. So that when I give that example, it's not a New York example or a Texas example that they're like, I don't know the joke or I don't understand what you're saying. But if I put it in their terms, they're like, I got it, doc. Like, I got it. And so why not
So
use it in
yeah,
that
so that's
way?
all really cool. Now I can hear people saying, so how do we know all about accuracy,
Yeah.
right? Reliability and validity,
Yeah. Let's talk
right?
about that.
Of all of this, right? So let's
Yeah.
talk to that.
Yeah. I love this part, the ethics, the biases in the equation, all of this stuff.
The
So
hallucination, all the things we're
yeah,
terrified of.
yeah. So let's and then even taking your job, we go there next after that one. So big picture on hallucination, for those that don't know, because hallucination sounds weird, but basically it's this. I call ChatGPT like the smartest person I know, and I give this analogy that I could ask it anything I want 24/7 and it'll always answer. But the problem is my friend sometimes fibs, sometimes tells me lies, sometimes it's a half true, half true and false. But then the problem is it's so good of a lie that I don't see it coming. I
Mhm.
don't like, I don't even understand it to the point where it could be lying and my best friend fools me because it sounds pretty darn good.
Yeah.
And that's the problem with ChatGPT. And so when I talk about ChatGPT, I feel like it's the equivalent of Kleenex. Everybody talks about ChatGPT because it was the first one. But in reality, we got everything. We got Bard, we got MedPalm 2. There's other brands that are
Okay.
coming. And those brands are, in my opinion, some of these are more specific for healthcare.
Okay. So
So I feel
OpenAI,
like
ChatGPT is kind of the generic for everybody, but there are ones that are
exactly,
coming out that go in depth, that actually will
exactly.
go into the research and go into the medical journals
Yes,
more specifically.
yes.
Okay, gotcha.
And so the way I explain ChatGPT, I feel like it's pretty darn good. And through 4.0 has less hallucinations than 3.5 and does a pretty good job. But it's still, I still think, in my opinion, it's inferior to other models that are like you just said, that are strictly trained. But then here's the big aha moment. There's companies that are, let me go back. There's ChatGPT use human beings, and a lot of them from Africa. They paid them very low wages and said, okay, here's an output. What do you think? Agree or disagree, and tell the model why. And then they help train the model.
Yeah.
what companies are doing that I think is really smart is instead of taking a generic human being, they're taking the doctor, but they're taking the right doctor. So I'm an ER doctor. They would give me ER questions and I would train a large language model like ChatGPT, but let's call it brand X. And I would only focus on ER questions and I would give my expertise on ER. What's going to happen now is when anybody asks a question, it's coming kind of from me and from other millions of other ER doctors out there. And so then that model is doing a darn good job. And so those are the applications that I see coming in the near future, because I know there's already several companies that have announced and there's some beta and there's some doctors training it. And these are big companies like DeepMind and already has this product, and MedPalm 2 is basically an offspring of that. Then we got Glass Health AI, so doing that same model. So big picture, that would help address the elephant in the room, which is the hallucination. Now,
Absolutely. I mean, it's like you wouldn't send, a science teacher to edit a poetry book, right?
exactly.
You need people who are in the profession doing the editing and the quality control.
Exactly.
Yeah.
And so big picture, I'm really, really stoked because I feel like now going to back to the main topic of burnout, for instance, if I can think of it as my best friend, now it's my medical assistant AI that I can say, hey, tell me the top 10 things based on this patient that's in front of you. And I know I'm going to get way futuristic here, but the future is here in the sense that there's going to be robots here by the end of the year. And so if you're able to tie this large language models to the vision of that camera, to that language that we just talked about, now I have an amazing assistant that the assistant's like, hey, this person's based on their skin, I know their sugar is this, and this is their average. And I'm like, wow, okay, we need to test you for diabetes. Like, hey, did you know that? And you're like, whoa. And so now if I'm a human being, I remember working 24, 30 hours, and at 2 in the morning, I was not the best doctor compared to hour one. And
Sure.
so how amazing to have this, let's take the robot away because I know it scares people a little bit, this ability for me to have a consultant on the side and say, hey, here are the specifics, here's what I think, here's the possibilities. What do you think? And then for the AI to say, hey, did you consider XYZ? And me look at it and be like, nah, I don't believe in that. We're good. Or for it to say something, I'm like, you know what? Actually, I hadn't thought of that one. Let me add this other test. And so here's how it would help me make my life less stressful, and help me because, when I'm really tired and fatigued, I'm just a human being. It's happened to a million of other doctors out there.
Absolutely. Yeah.
So I
Yeah.
think that'd be another amazing application.
Yeah. So let's take you at 2 in the morning at bedside with a patient who's just out of surgery, and your medical assistant is giving you some advice. The fact that this isn't just ChatGPT anymore, that this is a medically specialized AI, gives you some assurance of the validity and the reliability and the credibility of the information that you're getting. It's
Yeah.
not just so the fact that you're tired, your ability to proofread, edit, read critically, what you're getting is going to be diminished. We understand that. So having this tool with elevated levels of reliability is going to be even more important because you could just go, oh yeah, what he said.
So I want to give this example because there's two sides of this coin.
Good.
I'm a doctor that's trained in emergency medicine, and I have more medical training in that space versus someone coming off the street that has no medical background, or let's say they're an expert at Dr. Google versus me. Now, a lot of the tendencies out there is to say, oh, I'm just going to jump on ChatGPT and I don't need a doctor. The fact of this hallucination, we still need a doctor. And even if we have the most impressive large language model that we talked about just now, that it would be just on healthcare and it's been pushed by doctors, you still need a doctor to verify it. Case in point, your internet goes down, what do you do? Wi-Fi is down, what do? You still need to be the expert. You can't just say, okay, we're just going to put this on autopilot, fire all the human beings out there and just use this. That's not going to happen. And again, to my point when we started, there's trust. No human being is going to say, I'll take the AI versus the human. They're going to be like, no, I want the human. With that said, there are some verticals, like some people have said, I actually feel more comfortable talking to a robot about mental health and telling it my intimacies because I really don't want another human being judging me. I
Yeah,
get
that's
it.
interesting.
And that's a different spin, but I could see that. The other is going to be a finance push where I see this happening in the future, assuming legislation and lobbying and all that stuff, put it aside for a second. But I think in the future, it may not happen here in the United States first, but I see this happening in other countries before here. Your patients are going to get a choice. Here's the price for the human being. Here's the price for the AI. The doctor's still going to sign off on the AI, but the majority of this is going to be the AI. And so then the consumer is going to say, well, for this problem, for what it is, I'm just going to go with the robot. And others are going to be terrified of the robot equivalent and say, no. I want to go with human. And
I
I
mean,
see
what would
that.
make a patient even qualified to make that decision? I mean, other than, it's based on finding by out of pocket, right?
Yeah,
Just-
I
Yeah.
honestly think that's what's coming because there's such a strain on the system. There's so much finance behind it where if somebody has zero insurance, they're going to say, you know what, I got to go with the cheaper option. It may not be the best. And I know in the United States, something like that's not going to exist overnight.
Mhm.
But when you look at risk versus benefit ratios in third world countries,
Mhm.
where some places have zero access, this is the best option for that population. And the leaders of those countries will say, you know what, it's either this or nothing, and people are dying. We need to do something.
Sure. And well, and even in the United States, we have so many rural communities now that are medical deserts, right? They're food
Yeah,
deserts, but they're also medical deserts. They don't
yeah,
have healthcare within, a couple hundred miles,
yeah,
a healthcare provider rather,
yeah.
within a couple of hundred miles. So,
So
we
that's
have some of that problem here too.
yeah. So that's my 2 cents that I think
Huh.
this is what's going to happen in the near future. And I think it's going to, ironically, it's going to be third world countries kind of being, I hate to say it, guinea pigs, but being guinea pigs on the subject to see how it works and the good, the bad, and the ugly. And then patients here in the United States to say, you know what? I want that. I want option X. I want that one. And then pushing their legislation, their leaders, their congressmen to change the laws here. And I eventually see that some of those things happening here.
Yeah, and I can hear people saying, well, there we go again, experimenting on Black and brown bodies, for the benefit of, of the wealthier other countries, right?
Yeah.
Before we have to. So what if and understandably, because that they would get the biggest, bang for the buck in terms of healthcare outcomes, but who would it be the World Health Organization? I mean, who would be the international governing body to ensure that people are not, again, the Hippocratic Oath, right? Who do no
Yeah.
harm,
Yeah.
right? So that it's controlled,
Yeah.
and and there's criteria for determining when, okay, this is starting to be problematic and we need to shut this down or we need to pivot,
Yeah.
something.
I really think it's going to be the world leaders of those countries. So if we're talking about third world country, then it'll be the leaders in legislation for that third world country. And I think it's going to be them. But you're right. Who's going to supervise those countries? Will it be the
Right.
World Health Organization saying, hey, what you guys doing to your citizen is crappy? Like, no, you shouldn't be doing that.
Mhm.
It's going to be quite interesting, the
Because they
world we're
might have
about to survive.
financial incentives, right? If
Yeah.
to yeah to just let things go, and
Yeah.
they're not medical practitioners, they're not medical professionals,
Exactly. So they're going
right?
to have to jump in on their medical professions for those countries to say, hey, what do
Mhm.
you think? And can we do this?
Mhm.
The other thing is we need to talk about is the bias.
Yeah.
So garbage in, garbage out, whatever's in that large language model, whatever's been put in, if it's garbage, it's going to put garbage out.
Mhm.
And that goes back to the reinforced learning from doctors and healthcare providers. And like you mentioned, taking that data from medical research. Well, what if I told you the medical research is for a type of citizen, color citizen, and that the majority is for X and Y, and then that's what was trained in the large language model. And as a result, the
Mhm.
model is missing the population that wasn't represented in the study. Therefore, the information that's coming out is biased because it never was intended.
For
It-
example, your face recognition, right? You can
yes,
see in
there's in
my
the
face if
news.
I'm suffering from diabetes, but if my skin was darker, how capable would that camera be in detecting that?
Exactly. And there's a lot of news about that, about how AI has been trained for certain populations in the world, and it's reflected in, unfortunately, in the bias. And then
Yeah.
the large language model has created a bias. The other one that people don't talk about that's actually interesting in this space, since we're talking about the topic, is just because ChatGPT was made, that doesn't mean that the output or the way it comes out, the translation in other languages is the same. We all know that things
Ah,
get
good
lost in
point.
translation. So
Mhm.
someone, I'm just gonna make up a country, China, the output may not be the same as if it were in English, and things get lost in translation. And then there's also something called token size, to get a little geeky. Just think of
It's
it,
called what, say again?
token size. Think
Token
of it,
size. Okay.
yeah, think of it as the amount of times you can touch the keyboard that goes into ChatGPT will determine how much the max will be able to come out. So
Ah,
if your language requires more texting to put it in, then you're already cutting down the output that's coming out.
mhm.
And if you're also accounting for translations where there may not be a word, in English is one word, but maybe in another language it's like 5 words.
Right.
Now you're using up 5 words, and then you start putting it into a large text and putting it out. The output that comes out is not the same. And
Mhm.
so what's going to happen in the near future that I see to correct that is other countries are going to have to create their own model in their own
Ah,
language to get the
mhm,
maximum effect of that, and to put
mhm.
in their particular populations and cultures and things to really go in there so that way it gets the most out. Just
Ah, okay,
food for
okay,
thought.
gotcha.
Yeah.
So if there are experiments going on in other countries, in third world countries, that by definition they'd have to be English speaking,
Yeah.
so that narrows it down.
Yeah, it's
Yeah,
gonna be quite interesting. I
yeah.
mean, very interesting.
Mhm,
Um, so
mhm.
anyway, this space is exciting. I think big picture, um, I'm very optimistic, or else I wouldn't be waving the flag of ChatGPT in
Sure.
healthcare.
Yeah.
And I think big picture, I think we are gonna save lives. I think big picture, we're gonna lower the price of healthcare. And more importantly, we're going to improve patients' quality of life, like we talked about, giving better discharge instructions, preventing disease. And then fast forward, as a result of all of this, I think we're going to live longer. Um, just to play devil's advocate, what if tomorrow OpenAI said, you know what, we've been subsidizing this for 20 bucks a month, but in reality is 500 bucks a month. So if you want to
Mhm.
continue with all these benefits in your life and live longer, we need 500 bucks from you a month. And that would be another issue that becomes ethical, because now you're taking away a tool that people are using. You can argue that it's saving lives, fast forward with the right LLM, and now it's going to become like another hairier issue.
It's
So
either subscriber or advertiser model, right?
yeah,
On
but it'll
that.
be interesting, you
Yeah,
know?
yeah, unless, philanthropists, decide to fund it. So, kind of, and thank you for coming back to the point of burnout, because there's an overabundance of research on how the administrative burdens of electronic medical records which were intended to be like storehouses of information, but have actually created more time, like the work after work for physicians. So, and if you're, for example, a surgeon and you're seeing patient after patient after patient, you're doing your work, you're writing afterwards, and sometimes you're forgetting the patient that you had in the morning. So there's the beauty of this is that it takes away a lot of that administrative burden, and helps to improve the quality of the output as well. Another kind of piece that my research found, Harvey, was all the misinformation and disinformation that patients come to their doctors with. And you said it beautifully when you talked about Dr. Google, right? Like, I did my research, right? I'm not a medical professional, but I did my research and I Googled it and it said this, but you're telling me that.
Yeah.
And now, instead of me being passive and acquiescent, I'm being argumentative with you,
Yeah.
right? And saying, you're trying to cheat me and charge me more, or you don't know what you're talking about. And, that really, that existed
Hmm.
before the pandemic, but it was really amplified during the pandemic. And while it's come down some, it has, that agency that people feel,
Yeah.
is still there. So that cynicism, criticism, of doctors is an enormous part. So they've gone from, trying to save people from themselves to just saying, I'm going to try once, and if it doesn't work, I'm out,
Yeah.
Right. I mean, I'm oversimplifying it,
No,
right?
yeah.
But that's the burnout that
Yeah.
they're feeling, and as a result of this, which is, rather unprecedented historically.
I know other doctors hate me for saying this, but I see a future where no matter what, patients are going to use Dr. Google, and that's what they call it.
Yeah. Oh, sure.
And
Sure.
no matter what, patients are going to start using ChatGPT or have been using ChatGPT, and like it or not, it's going to happen.
Yeah.
And so if it's going to happen, I say just embrace it and teach the patients the good, the bad, and the ugly so that they know the dangers.
Mhm.
And then instead of fighting the technology, embrace it to the point where this is the part where doctors hate me for saying this. Invite your patient to bring their laptop to the office or give them a laptop that's able to ask questions and formulate the questions so that when they come see you, they unfortunately they only get 13 minutes with the doctor. Why not make those amazing 13 minutes so that they're high yield, so that the patient comes in with knowing what to ask, so they can ask ChatGPT, hey, I got diabetes, hypertension, blah blah blah, what should I ask my doctor at my annual visit? And then it tells you, and then it gives you follow-ups, and then you show up with the list, like, hey, okay, doctor, question number one. They're going to hate it, but guess what? Those 13 minutes are going to be high yield and get so much information out. And then I'm thinking in the future, why not have a physician assistant equivalent to sit with the patient and start having one-on-one dialogues to help patient and go through it and really teach the patient, because now from a burnout point of view, it's really hard for, again, going back to my first conversation, talking about communication, sometimes it's really hard to communicate. So maybe using AI and teaching and using all the stuff we talked about and having a one-on-one session with the healthcare provider and the patient maybe will prevent diseases. Maybe patients will start taking their medicine better or understand their disease process and know why the doctor wrote that prescription or know why they keep telling them X and Y, because now they really understand.
Sure,
And that'll
sure.
help with
And while
patient
we're never going to get all the patients, but that could help to convert, especially since a lot of people, there are going to be people out there who don't have laptops, but almost everyone, even in poorer countries and poorer parts of the country, have phones, right? And
exactly.
they still have access to the same
Yeah.
ChatGPT and
Yeah.
Google. Yeah.
Yeah.
So Harvey, what have I not asked that you think would be helpful for our audience to know, or that you would just like to share?
Yeah. I think one thing I like to share with everyone is there's not enough doctors and healthcare providers that understand AI.
Mm.
And so just like we all went to med school or medical training of some sort, nursing school, whatever professional school you went to, a medical assistant, we were given the tools up to a point, but given that medical knowledge doubles, meaning every 30 days, the amount of knowledge that I need to know doubles every 30 days, then I need help. I need a AI or something to help me. Obviously, I can read every day and learn as much as I can, but I'm still going to be behind. So what I'm saying is take the time to understand AI in healthcare and take the time to educate yourself so that way you yourself can train your staff and your local people around you, and you could be the rep at your local hospital level to say, you know what, I understand this. And so when company X comes in saying, hey, we're going to sell you this widget in AI, if it's going to make a difference, if it's cost effective, you'll understand these. So I'm really big on teaching this platform and helping our healthcare world because I feel like this is going to make a difference, but we need to know how to do it. So I want to make sure I told that out there.
Thank you. I think that's very reasonable. I mean, no technology is perfect out of the gate. Everything has its flaws, and that's why I love that you said that. We still need the human being. We still need the human professional to partner with this, and to and just like we embraced word processors back in the 80s, and and the internet in the 90s. This is the next thing. And let's embrace it as a tool that can help us and be clear-eyed and open to to where there might be some issues, and catch it, address it, and make it better.
Exactly.
So Harvey, what would you say are of our discussion for our audience through kind of three big takeaways that if they were taking notes right now, what would be like kind of the top three things that they can walk away and say, yeah, I learned something new about this today?
Yeah, number one, I think it's important to realize garbage in, garbage out. That simple point. If you are putting questions into ChatGPT equivalent and say, you know what, the output is horrible, maybe it's not the tool. Maybe it's how you're asking the question. Maybe it's if you were able to, what we call out there is prompt engineer. Maybe if you ask it better, maybe if you use medical terminology, maybe if you do those things, now you're getting a better output. So that'd be one thing we kind of talked about. The second is, I really think the future of AI is having healthcare providers be the leaders. And I know I didn't really talk about it, but we need to be the human beings and the right human beings, meaning the clinicians in ER should be talking about the ER LLMs or large AI models, whatever, in that space. But we shouldn't let Microsoft, although I love Microsoft, we shouldn't allow them to be the leaders. It should be a healthcare a physician or nurse, someone that knows healthcare to be the leader inside of Microsoft to help lead
Mm.
AI so that those products are right for our patients.
And they're also integrated, right?
Yeah,
We're not talking about parallel systems, we're talking about integrated systems. Yeah.
exactly.
Mhm.
And then the last is we talked about AI helping the burnout. I think it's important to not look at it as the enemy, to look at it with the eyes of this can actually help. But let's me as a healthcare provider, let me dictate how this technology should be used and how it should be integrated into my practice. And that's why it goes back to my second point that I need healthcare providers to be the leader in this
Mm.
space so that they can shape for the better products and integration in our healthcare.
And what are the healthcare products that are, I think you said they're still in beta
Yeah.
right now? What are you seeing on the horizon for the healthcare industry or for for providers specifically?
Yeah, I'm really excited and stoked about this product coming out that's called MedPalm 2. I did a lot of research. I read a lot of the research studies and I'm shocked how well it's doing. Like it's like
So med
86.3%.
palm as in palm?
Yeah, Palm,
Okay.
uh-huh,
Yeah.
2. And then that's the product that's coming out soon. And I read this week that the Mayo Clinic, is it the Mayo Clinic? I think it's the Mayo Clinic is already using that with their patients and figuring out how to use that. And I thought, man, that's already proof of concept.
Mhm.
The other one I like talking about is Glass Health, because they are using it. Again, it's reinforced learning, but it's very narrow because it's based on the doctors that they have in the platform. But it's something that I think it holds promise. The third one, I haven't seen anything from them, but I heard they got $50 million last month for their project, and it's called Hippocratic AI.
Mm,
And kind of like the Hippocratic Oath, but just add AI at the end and
mhm.
take the oath away. And they are working on large language models for healthcare. And then the last one that I like talking about is this company called Perplexity AI. And think of using ChatGPT, but it does a darn good job giving you references. And so when you ask a question, it gives you the answer, but then it gives you the reference. Now I'm gonna go out there and say, hey, don't trust any reference anyone ever in general gives you, because in AI world, it can actually hallucinate the reference. And so you
Oh,
may think, oh, this is perfect. And then the other part is you may check it and it may check out, but it may not reinforce what it said it's reinforcing.
okay.
So that mismatch.
Okay.
But these are all promising, I think, companies that I know there's more coming. And so I'm really stoked about this technology.
Well, thank you. And we need to acknowledge, so that today is July 10th in 2023. This is still very early days of this technology, and it's already made so much of a difference in a short time. So of course there are going to be, some issues and flaws that, that we've talked about, but it holds a lot of promise, not only again for patient outcomes, but also for being a healthcare provider and a practitioner of medicine, and and bringing that practice of medicine and being a human, helping a fellow human, back by taking some of that burden out. So I'm excited with you, kind of keeping an eye out for how these things track. Harvey, how do people find you if they want to connect with you on a deeper level on this?
Of course. My social media, I'm on all the platforms. It's Harvey Castro, MD, as in medical doctor. I joke and say I live more on LinkedIn, so I check that one more often because I have had some news media contact me on Twitter and others, and I don't do a good job checking it every day. But yeah, LinkedIn, and I love writing about the subject to the point where all the books behind me are all books that I wrote this year on AI and healthcare or some
Oh my
sort of
goodness.
AI. I've even done some books on AI and crime and how to solve crime with AI. So it's kind of been like a side pet project that I've enjoyed talking about. But then I love just the technology. So I'm constantly reading, pushing the envelope, posting on my LinkedIn, coming up with articles. So if you follow me on LinkedIn, you'll see a lot. That I think tags to Twitter. You'll see a lot of my articles.
Yes, and I can verify. I've seen your posts on LinkedIn pretty often. Thank you so much for sharing your knowledge, your insights, your ideas, and your enthusiasm about the future of medicine with artificial intelligence. This has been Tapping Wisdom. Thank you all for listening. I'm Sue Paternack. Bye-bye.